when you are asked to do the inspection, before shuttering the inspection, procedure is that first you should introduce the patient to your patient, introduce yourself to the patient. ठीक है, सबसे पहले अपना नाम बताना है कि मैं डॉक्टर सच एंड सच हूँ, मैं आपका एग्जामिनेशन करना चाह रहा हूँ, आपका इजाजत है या नहीं है. You should introduce yourself, take the consent, उसके बाद consent लेंगे कि आपकी इजाजत है या नहीं है, and then you should expose the parts. Expose which part have to be exposed. If you are asked to do the abdominal examination, you should expose from the epigastrium to the pubic symphysis. Take the consent and then expose from the epigastrium to the pubic symphysis. Rather than उसको कपर पाइप पे लेकिन pubic symphysis देना. Then once you are exposed, place the patient symmetrically and stand at the foot end. Foot end carpet inspection, whatever we are discussing, you should stand at the foot end and see all the things from the foot end. And then come on the right side. Some steps are to be done by standing on the right side, and then you should tilt downwards to see the peristaltic waves, whether the peristaltic waves are present or not. So what things are to be examined in inspection? These all things are to be examined in inspection of the abdomen. So you should see the shape of the abdomen. You should see the movements with respiration. You should see the umbilicus. You should see any scars, pigmentations. Style. Visible pulsations. You should see the peristaltic waves. And you should see the air distribution. Lastly, you can see if any mass is present, or you should see the hernial orifices. You have to see one by one all these things, right? You should stand in the foot end and consider all these things. जब एग्जामिनर आपसे कह रहा है कि आप शुड डू इंस्पेक्शन ऑफ द एब्डोमेन, तो आप फुट एंड पे जाएंगे, उसकी सारी चीज़ नोट कर लेंगे, अपने ज़हन में बैठा देंगे और देखते हुए बताते नहीं जाएंगे. एग्जामिनर बता रहा है यू शुड जस्ट डू द इंस्पेक्शन, एंड देन व्हेन द एग्जामिनर आस्क्स यू व्हाट आर योर फाइंडिंग्स, देन यू टेल ऑल द पॉजिटिव एंड द नेगेटिव फाइंडिंग्स, राइट? So you should go for the inspection one by one, so we shall take one by one. So first you should check the shape of the abdomen. Shape may be either flat or sunken or scaphoid. Or distended. Right? Normally it is usually flat, but at same level with the chest. If it is same level with the chest, then it is supposed to be flat. If it is boat shaped, sunken inside, then this is said to be scaphoid. And if it is protruding outside the thorax, then this is said to be distended. Now you must know what are the various causes of these signs. जब भी कोई पेशेंट साइन आप डिटेक्ट करते हैं तो आपको उसको कॉज आना चाहिए. जब कॉज आएगा फिर आप पेशेंट को डिजीज डायग्नोज करेंगे. What could be the cause of this disease? This sign, right? Normally it is flat. You can get in certain patients sunken and scaphoid, it is also said to be normal. स्केफॉइड बोथ शेड भी नॉर्मल हो सकता है, लेकिन अगर स्केफॉइड है तो दिस इज यूजुअली प्रेजेंट इन वेल नरिश्ड पेशेंट or if the patient has got some chronic disease like malignancies. अगर उसको पेशेंट को ग़िज़ा प्रॉपर्ली नहीं मिल रही, डाइट उसको प्रॉपर नहीं है, पेशेंट नॉट टेकिंग हिज डाइट प्रॉपर्ली, then is supposed to be malnourished patient. In malnourished patient you can get the sunken or scaphoid shape, or if the patient has got some chronic disease like malignancies, esophagus or stomach, then you can get the scaphoid shape abdomen. Distended, if it is protruding outside, then you should think of 5 Fs. 5 Fs. Most likely it is fat. Fat means patient is obese, nothing else. Patient obese. Fat. It could be fluid. Fluid inside the peritoneal cavity. This means patient has got ascites. Flatus or feces. This means patient has got intestinal obstruction. Or if the patient is female, it could be fetus. Patient must be maybe pregnant, so it should be fetus, right? These are 5 Fs. इसके अलावा दूसरा कॉज काउज हो सकता है, it could be malignancies. And that's malignancies, mass of malignancies, right? So if the abdomen is distended, then it could be either fat, fluid, flatus, feces, fetus, or it could be malignancies. Obstruction. We have done the flatus or feces, intestinal obstruction, intestinal obstruction. Herniation, you can get masses, but abdominal shape is not distended. You will get masses at different areas, but patient abdomen is not distended. Distended means full abdomen distended. Full abdomen distended. Okay, distended, you should think of all these causes when you are getting the distended abdomen. So first you should describe the shape of the abdomen. What is the shape of the abdomen? Then the next thing, you will see the movement with respiration. Normally abdomen will move with respiration, right? You should see the movement with respiration. If it is not moving with respiration, then mostly the patient has got peritonitis. Peritonitis. And normal movement is abdominal pause. This means it will bulge out during inspiration. It will bulge out during inspiration and it will go down during expiration. This is said to be abdominal thoracic respiration. But sometimes paradoxical occurs. This is said to be thoraco-abdominal respiration. If the patient has got diaphragmatic paralysis, or in certain females, you can get thoraco-abdominal type of respiration. Right? So you should see the movement with the respiration. The important thing is, if it is not moving with the respiration, then this is supposed to be peritonitis. But if it is reversed, then this is due to diaphragmatic paralysis, or in certain females. So you should see the movement with the respiration, then you should see the umbilicus. Normally umbilicus is between the zyphisternum and pubic symphysis, and it is inverted. Slit is inside, inverted. But if it becomes everted, umbilicus protruding outside, then it could be either due to ascites or any mass or any malignancy inside, patient has got umbilical hernia. Or if the patient has got umbilical hernia, then it will be everted, protruded outside. You should see the umbilicus whether this is inverted or everted. Normally it is inverted and centrally placed, right? If it is everted, then this could be due to ascites, it could be due to malignancies, or it could be due to umbilical hernia. So these three important things are to be seen: shape of the abdomen, movement with respiration, and position with the umbilicus. Then further you should see any scars present or not. The scars could be clear surgical scars, and from scars you can diagnose what type of surgery has been done on that patient. Right? For example, subclavian scar है और appendicitis surgery हुई है. Right iliopsoas में scar है, appendicitis पर surgery हुई है. Vein में अगर scar है तो then kidney की surgery हुई है. Umbilical है तो फिर उसको कोई severe infection या strectomy हुई है. Right? Depending on which side the scar is present, you can diagnose which type of surgery has been done. It could be clear-cut surgical scars. अगर white scars हैं तो old scars हैं, red scars हैं तो recent scars हैं, or it could be irregular scars. Irregular scars means patient has undergone certain trauma previously. कोई road traffic accident हुआ है या step wound हुआ है, so that could be irregular scars on the abdomen. Right? So you should see any scars present or not. White scars indicating if the patient has got old scars, तो पुरानी 8-10 साल पुरानी सर्जरी हुई. Red color scars मतलब recent उसको 1-2 महीने में सर्जरी हुई. You should see the color of the scar, whether it's a white scar or red scar. White scar means old surgery, red scar means recent surgery. Then you should see the pigmentations. Pigmentations. Any pigmentations are present or not. Pigmentation अगर color उसका abdomen का change हो गया तो this is said to be pigmentations. Right? Pigmentations could be of various type. For example, linea alba अगर है. What is linea alba? Straight pigmentation in the midline growth of umbilicus. This means patient has been pregnant before. Main important pigmentations, you can see the equivalent sign. Or gray color sign. Equivalent signs are pigmentations around the umbilicus, and they are present usually in the pancreatitis. Even gray color signs are present in the flanks, and this is again due to pancreatitis. These important pigmentations could be present on the abdomen, which you should look for. Then you should see the stripe. The stripe means patient abdomen has been stretched before. So if the patient has got previously any ascites, you will get a stripe. Or if the patient has become pregnant previously, you can get a stripe, and that is said to be stripe gravidera. A stripe gravidera. Before pregnancy, there is stripe gravidera. अगर purple colored stripe यहाँ है, if there is a purple colored stripe, then this is present in Cushing syndrome, or if the patient has got corticosteroid therapy before, then you can get a purple colored stripe. So this stripe would be either due to previously ascites, or it could be due to pregnancy, or it could be due to Cushing syndrome, or the use of corticosteroids. Then you should see the veins, whether there are very visible veins or not. No visible veins are present over the abdomen. Right? If they are present, they are always abnormal. Right? If they are present around the umbilicus, this is said to be caput. Means patient has got portal hypertension, and due to the portal hypertension, most likely due to cirrhosis, patient will develop dilated veins around the umbilicus. If you are getting the dilated veins in the peripheries, then it could be either superior vena cava obstruction or inferior vena cava obstruction. You should see the direction of flow. If it is from below upwards, then this is inferior vena cava obstruction. If it is from up down, from ऊपर से नीचे आ रहा है, then this is superior vena cava obstruction. It could be superior vena cava obstruction or inferior vena cava obstruction or portal hypertension. You should see the dilated veins. Then you should see the pulsations. Again, if the patient is normal, flat abdomen, you may not get the pulsation. In thin and lean persons, you can see the pulsations in the epigastrium. Aortic pulsations are there. The thin and lean person normal. Or if the patient has got some stress or confused or tense, then you can see the pulsations in the abdomen. Pathologically, if the patient has got aortic aneurysm, or any mass or malignancy just above the aorta, then you can see pathological pulsation in the epigastrium.
सर ये आपने कहा था वेन में हम लोग फ्लो देंगे ऊपर से नीचे ये में हमने इंस्पेक्शन
नहीं, वो जब पल्पेशन में आएंगे फिर करें. अगर इंस्पेक्शन है तो उसमें टच नहीं करना है. आपने सिर्फ देखना है. तो अगर आप कमांड ये भी दिए कि सर यू शुड डू द इंस्पेक्शन, यू शुड जस्ट सी देयर आर विजिबल वेन्स ऑन द फ्लैंक्स और इन द अराउंड द लाइन्स. फ्लो पर आपने पल्पेशन है. तो आज जब हिस्ट्री देंगे फिर कंप्लीट फिजिकल एग्जामिनेशन करेंगे, फिर आपको पता चलेगा. फिलहाल हम डिस्क्राइब करेंगे पल्सेशन से. पल्सेशन के फिर अगर ज़्यादा का पल्सेशन आ रही है, यू मेंशन द पल्सेशन, आपसे बिकॉज पूछेंगे व्हाट आर द डिफरेंट कॉजेज ऑफ दिस पल्सेशंस. बाकी फिर उसकी इन्वेस्टिगेशन करेंगे, फिर ही पता चलेगा व्हाट टाइप ऑफ पल्सेशन इट इज. व्हाट इन्वेस्टिगेशन डू? Definitely should go for ultrasound, should go for CT scan later on, take the proper history, तो फिर आपको पता चलेगा what type of pulsation it is. Okay, after pulsation you should see the peristaltic waves. For peristaltic waves, you should come on the right side. बाकी सारी सीरीज आप फ्रेंड से करेंगे, लेकिन peristaltic waves के लिए आपने अपनी राइट साइड पे आना है और थोड़ा सा स्किन लेवल पर झुकना है. So if you have seen any waves over the skin, then these are the peristaltic waves. So waves, pulsation up down is systolic pulsation. वो pulsation separate करनी है. Waves बाकायदे from the right side to the left side जाती हुई महसूस होती है. Right? अगर pulsation peristalsis हैं, तो peristaltic waves will be present if the patient has got pyloric stenosis or if the patient has got obstruction at the ileocecal junction. Or any intestinal obstruction है, you can get this peristaltic waves visible when you are going on the right side and tilt yourself at the skin level to see the peristaltic waves.
सर ये नॉर्मली दिखने
नॉर्मल देखने नहीं है. अगर किसी को pyloric stenosis है या intestinal obstruction है या ileocecal wall पे obstruction है, then you can see these peristaltic waves. Normally नजर नहीं है. अल्सर के बाद पायलोरिस हो सकता है. अल्सर अगर क्रोनिक अल्सर हो तो फाइब्रोस हो जाएगा, पायलोरिस हो सकता है.
सर राइट टू लेफ्ट ही मिलेगा,
लेफ्ट टू राइट. लेफ्ट यूजुअली पेरिस्टाल्टिक वेव मिलेगी, लेफ्ट टू राइट मिलेगी. लेफ्ट आपको कॉन्डम से या तो राइट साइड पे जाती महसूस होगी या डाउनवर्ड जाती होगी. अगर लेफ्ट टू राइट हॉरिजॉन्टली जा रही हैं, दीज आर मोस्ट लाइकली ड्यू टू पायलोरिक स्टेनोसिस. अगर डाउनवर्ड्स एंड टू द राइट जाती महसूस हो रही है, then there is obstruction in the right area, in the ileocecal junction. Then you should see the hair distribution and describe whether this is male pattern or female pattern. Convex upwards, going up to the umbilicus. Female patients patient there is a concave border upwards and limited to the pubis. लेकिन अगर ये पैटर्न चेंज हो जाए, फीमेल में मेल पैटर्न या मेल में फीमेल पैटर्न, तो you should diagnose. Hormonal imbalance. Hormonal imbalance. If the male patient has got estrogen secreting tumors. Yeah, due to any cause, the estrogen level is increased. For example, in cirrhosis of liver, you may get estrogen level increased, and you can get the female pattern in the male. और female में अगर androgen secreting tumors हैं, तो then you will get the male pattern in female patients as well. You should check for the hair distribution whether this is normal or not. Hair distribution. मेल के हेयर डिस्ट्रीब्यूशन अम्बलाइकस तक चलती जाती है और देयर इज कन्वेक्स पैटर्न लाइक दिस, अपर बॉर्डर कन्वेक्स होता है, फीमेल पैटर्न में सिर्फ प्यूबिक होता है, तो हेयर डिस्ट्रीब्यूशन इज कनकेव पैटर्न, कनकेव पैटर्न. Then you should see any masses are present in the abdomen or not, right? So different masses, अगर liver massively large है, spleen massively large है, you can visualize by a difference in symmetry of the abdomen. ठीक है? अगर left hypochondrial mass लग रहा है या right hypochondrial mass लग रहा है, तो mass are due to liver or spleen. So this could be due to either splenomegaly or hepatomegaly. It could be hernias at different levels. Epigastric hernia भी हो सकता है, paraumbilical hernia भी हो सकता है, incisional hernia भी हो सकता है. So there could be hernias at various levels. There could be malignancies inside which are protruding outside. So you can see the malignancies as you should see them as masses, and then you should see the hernial orifices where the inguinal hernia is present or not. Right? So last is masses or hernial orifices. ये सारी चीजें आपने देखी.
hernial orifice के लिए कफ रिफ्लेक्स करवाना
कफ रिफ्लेक्स कराना पड़ेगा. hernial orifice के लिए actually you should see the hernial orifice in palpation, लेकिन इंस्पेक्शन में भी आप इंगुइनल रीजन एक्सपोज करके पेशेंट को कफ रिफ्लेक्स कराएंगे, उसमें मासेस एक्सपोज हो रही कि नहीं हो. अगर मासेस हैं कफ रिफ्लेक्स कराएंगे तो उसमें आपको hernial orifice से पता चलेगा hernial orifice नॉर्मल है क्या नॉर्मल. So this is how you do the inspection of the abdomen, right? तो ये जब भी आपको कमांड मिलती है, you do the inspection of the abdomen. So first of all introduce yourselves, take the consent, expose the parts, expose from the epigastrium to the pubic symphysis. Patient must be symmetrically placed, एक पिलो उसके नीचे होना चाहिए और आप सीधे फुट एंड पे चले जाएंगे. ये सारी चीजें आप नोट करेंगे, राइट? फिर राइट साइड पे आ जाएंगे, राइट साइड पे अपना झुकेंगे. ये सारा एग्जामिनर को दिखाना है, एग्जामिनर को दिखाने के बाद डूइंग ऑल दिस थिंग्स. ठीक है? उसके बाद जब आपने कर लिया तो वापस कवर करेंगे पेशेंट को. ठीक है? एक बार जो एक्सपोज किया वापस करेंगे कवर. आपने जो कवर कर लिया इसका मतलब आपका एग्जामिनेशन कंप्लीट हो गया. अब एग्जामिनर आपसे पूछेगा व्हाट आर योर फाइंडिंग्स, राइट? तो इसमें जो भी पॉजिटिव और नेगेटिव फाइंडिंग्स हैं सारी आपने बताना, राइट? फॉर एग्जाम्पल एवरीथिंग इज नॉर्मल, तो आप बताएंगे शेप ऑफ द एब्डोमेन इज फ्लैट, इट इज मूविंग नॉर्मली विथ रेस्पिरेशन, इट इज एब्नॉर्मल thoracic टाइप ऑफ रेस्पिरेशन, umbilicus is centrally placed and inverted. There are no scars, no pigmentations, no striae, no visible veins, no visible pulsation, no visible peristalsis. Hair distribution is either male or female pattern. There are no masses and hernial orifices are conflict.
आपने बोली उसके thoracic abdomen same है, कोई difference नहीं.
पता क्यों होता है ना, जब आप इंस्पायर करेंगे तो एब्डोमिनल बल जाओगे, जब इंस्पायर करेंगे तो एब्डोमिनल बल जाओगे, जब एक्सपायर करेंगे तो एब्डोमिनल गो है. सो नॉर्मली एब्डोमिनल thoracic टाइप ऑफ रेस्पिरेशन. अगर इसका रिवर्स हो जाता है इंस्पायरेशन में, हाँ, दिस इज ड्यू टू डायफ्रामेटिक पैरालिसिस और इट इज कॉल्ड स्पार्को एब्डोमिनल, राइट? तो दिस इज हाउ टू डू द इंस्पेक्शन ऑफ द एब्डोमेन. ठीक है? एनी क्वेश्चंस इन द इंस्पेक्शन ऑफ एब्डोमेन? सब कर लेंगे. ये सारी चीज़ें आपको मेमोराइज होनी चाहिए कि जब हम आपसे कराते हैं तो फिर आपको कोई ना कोई चीज़ भूल जाती है. अगर ये 10 की 10 चीज़ें आपने बता दी, you'll get 10 मार्क्स। अगर इसमें कोई चीज़ बताना भूल गए, पॉजिटिव हो या नेगेटिव, आपने ये नहीं कहना सर एब्डोमिनल इंस्पेक्शन नॉर्मल है, नॉर्मल है तो आपको 0 मार्क्स मिलेंगे। ये तो एग्जाम में ज़्यादा क्वेश्चन ये करते तो सर नॉर्मल है, नॉर्मल, देयर इज नथिंग नॉर्मल। You should describe all the positive and negative findings in your finding क्या, you should tell us all the positive and negative. Okay.